Good afternoon, listeners. Thank you for joining us on today's Healthy Community. We air Fridays from 12 to 12:30. Today's Healthy Community aims to improve health literacy by providing and offering resources and information that strengthen and support the wellness of individuals, families, and the communities in which we live. Today's topic is broad. There's a lot to cover. As you know, healthcare is an extensive topic of concern and interest for people here today as we rapidly look at a different healthcare environment and healthcare delivery system. And so we have the great pleasure of inviting and having Dr. Mark Epstein here with us. I'm going to tell you a little bit about him. Pretty impressive, Dr. Epstein. You're an emergency room physician. You earned your undergraduate degree in human biology from Stanford University and your medical degree from Yale University. Dr. Epstein completed his residency in emergency medicine at the University of New Mexico Health Sciences Center in 1995. He also earned his master's in business administration from University of Tennessee's Physician Executive MBA program in 2007 and was honored as an outstanding physician leader. He's currently the Chief Medical Officer for True Health New Mexico, part of New Mexico Health Connections, in which he is the founding Chief Medical Officer. He leads a multidisciplinary medical management team. Gosh, I could go on and on about you, Dr. Epstein, but I think here today, maybe we can demystify some of the information that's being thrown around right now. I know working in healthcare myself and working with healthcare professionals, I think half of our conversations consist of acronyms, which might not mean most anything to the average listener. And so I think that you may be able to shed some light on that information, and we can discuss perhaps where we'd like to go in the future, what our focuses are as a state, and of course with your organization. And I think it sounds like there are multiple forces at work here. And when we talk about the winds blowing on these choppy seas of healthcare, maybe you can talk to me about some of the things that your organization is focused on, and as a leader in healthcare, how we can engage patients for better healthcare.
Well, thanks, Rebekka. Absolutely, it's quite a confusing sea out there, if we can continue the metaphor, and so many acronyms. The language is confusing. Where the money flows, how patients access care, who pays for that care. Do I know my provider? Am I getting the best care possible? It is really an immense challenge for folks to tackle, even when they're feeling their best and most healthy. Now, you compound that with somebody who's in a crisis of health or dealing with chronic issues that many of us face on a daily basis, and even throw in the associated symptoms of depression and anxiety that can accompany chronic disease. And then you really got a mess on your hand, and the need for communities to really pull together to make sure that people get the care they need. And obviously this impacts quality of life. I mean, there's no debating that. But it's an economic issue for New Mexico as well, from the standpoint if we don't have healthy, happy, vibrant population and communities and individuals in that community, we can't be the economic force that we intend to be as a state and drive for the lifestyle and the quality of life we're trying to do. So healthcare is everything, I like to say, and maybe I'm biased. But, if you don't take care of the basics and we don't take care of each other here, then we're in for a world of hurt. So I appreciate the chance to kind of pull apart some of the forces that are influencing the world today that we're trying to figure out. We could start anywhere, but I think there's been so much confusion around Obamacare and what the intentions were there, and changes that are coming forth from the new administration, and how things are paid for. But let me just start there by saying it is a rapidly moving environment, and it can be so confusing. Who pays for it, and how do I get my care? So what our approach has been at the health plans that we have created is to put our members front and center. And that means ensuring access to primary care as much as possible so that you can connect with the provider, understand your health risks before you encounter trouble, well upstream of having to be hospitalized or visit an emergency room, so that you can be empowered with as much information as possible to manage that care yourself and be sharing that decision-making with your provider to keep you out of trouble upstream. So let me just give you a kind of a very, what appears to be mundane but very important pragmatic approach. If you have one of, say, 9 chronic conditions like coronary artery disease or depression or anxiety or congestive heart failure, we have designed our benefits as a health plan so that you pay $0 for generic medications to manage that chronic condition or those multiple chronic conditions. Why do we do that? Well, to keep you out of trouble. If you have no barriers to accessing your medications that keep you in the best state of health possible, then you're much less likely to end up in an ER, to end up in an intensive care unit. And the upside there as well is if you stay healthier, then you spend less money and premiums don't go up across the whole state. So that impact is not only great for productivity of our state, but for the individual keeping out of trouble. So that's just one kind of concrete example where we want to move upstream to keep people healthy and really engage people themselves and say, how do you help? How do we help you help yourself in accessing the care that you need? So a lot of different places we can go there in terms of how we want to address and embrace our population. One of the great features, and there's been a lot of confusion about the upside of Obamacare and the downside and what it means in Medicaid expansion as well. But one of the best intents is, hey, let's get everybody together into insurance as much as possible, as much as the political forces would allow, to ensure that you can get the access to insurance, access to financial coverage, and access to care to keep you healthier upstream. We got a long way to go there. It's imperfect. There's a lot of places where people have been left out, and frankly, a lot of places where folks are just simply confused by the process, or the premiums still remain unaffordable. So, Rebekka, I've covered a lot of territory there. You tell me where you want to go with this. There's so many different places to go.
Well, I will comment on some of the dialogue that you did offer and understanding that we do need to reduce healthcare costs. I think it seems reasonable and certainly an admirable, honorable goal to engage with patients and give them this information so that we can reduce the cost of healthcare. I think a lot of the savings, number one, would be reflected in premiums that don't go up or possibly are reduced. Better outcomes and quality of life for the patients, of course, which, as you pointed out so wisely, does improve our productivity in this state. And looking at the savings, it can be reinvested, if you would like to look at it that way, in additional supports aside from primary care providers and specialists like case management folks and care coordinators and that to continually improve the healthcare delivery system and the access that patients have for supports to continue to become healthier citizens and thus feed or nurture, if you will, this new healthcare delivery system in such a way that more folks have opportunities and are supported to bring about the quality of life that we all seek for our loved ones and ourselves and our families and friends. You talked a little bit about how healthcare may be paid. That may be something of interest to people. I think a lot of people don't understand how that works. And I had mentioned in one of my last episodes, as we move from value-based or treating illness as opposed to improving wellness, fee-for-service kinds of models towards value-based reimbursement or outcomes types of models. Can you talk to us a little bit about how healthcare is financed and paid for?
Absolutely. And it starts from the premise of You don't wake up in the morning thinking, I'm going to be a patient today, or I'm going to be a health plan member. That's a fundamental is we want to be citizens living productive lives. So the historical model has been, though, that healthcare is an experience that I as an individual have when I walk into a doctor's office and I have an appointment and I have some issues addressed. We are moving for paying for health care. We are moving beyond that simple, transactional, episodic notion of health care to it being more of a total picture of health, that your health care as an individual is affected by decisions you make every day, the environment you live in every day, and the care that you received outside of the office or hospital setting. And the financing of healthcare has to reflect that as well. So we're moving away from that volume-based, that's the buzzword that's often used, fee-for-service, another buzzword, but largely kind of transactional world, to more of a total health model where dollars flow to take care of populations and the individuals in those populations over a time period, as opposed to paying for a transaction, an event, an episode on a almost retail basis, if you will. So the movement is towards providers themselves actually receiving what would normally a health plan would receive of premium dollars. The actual providers themselves are receiving those dollars up front to care for those folks in their charge in their community. And that frees them up to do things that are historically not that traditional, like telephone visits or emails, or deciding, I don't need to see you in the office. Let me just check in with you a little bit down the road. Maybe even you can take a picture of the wound, send it over your iPhone, let me know, and I'll take a look and see if you really need to come into the office. The model that historically has been set up from a financing standpoint is, again, that transaction, that event, that episode, and that's what drives the volume fee-for-service world that we've been in. And as we move to more value-based care, where, and that's another buzzword, but what does that mean? It means the care that you get in between visits by care coordinators, community health workers, that may not even be that technically medical. For instance, help with getting your medications refilled because you have transportation issues, or clarification around how am I supposed to take this medication, or other areas where people, if they're not accessing that information or care, can end up in an emergency room. Those are the kind of activities that we want to reward and honor and recognize that it brings great value by keeping people healthier. How that gets paid for is a pretty complicated set of activities, and frankly, there's a lot of inertia. There's not a lot of transparency in how money flows through the system. And that lack of transparency, I think, really leads to some fundamental problems that we have to solve today. And if you'll indulge me here, with the lack of transparency, what you often see is cost shifting from one population onto another. For instance, if I'm a large hospital system in any state in the United States, and the folks who come through my doors are largely uninsured, that means that as a hospital, I'm going to have to charge those who are insured a higher amount of dollars to cover my costs. That cost shifting, that fragmentation of financing, makes it hard for us to understand what the actual cost of care is across a population.
Dr. Epstein, we're going to have to take a short break, but I'd like to continue this conversation about how the healthcare dollars flow and move into some other really interesting topics. We're going to take a break. We'll be back with Dr. Mark Epstein, and thank you for joining us on today's Healthy Community. Welcome back, listeners. You're visiting with us today during today's Healthy Community, a show that aims to improve health literacy for all the folks, listeners here in this part of the state and actually around the state. Today we have the great pleasure of having Dr. Mark Epstein, who is the Chief Medical Officer for True Health New Mexico, and we're going to jump right back into our conversation as you were explaining, Dr. Epstein, kind of finishing up on how healthcare gets paid and and some of the complications or details on that?
Yes, and so we were just briefly talking about cost shifting, which can be very confusing. And actually, as a patient, as a health plan member, I don't want to know about that. I want to know, can I get the care that I need to get, and can I know what it's going to cost me when I do that? And so bringing clarity and transparency to how money flows through healthcare and how I access healthcare is going to be really important. We're lucky in New Mexico to have a growing health information exchange. Let me explain what that is. The electronic health records for many providers across the state, including in southwest New Mexico, flow into a large database. Those clinical data repositories, or the information that flows in, helps bring clarity on several levels. What are the needs of our population, and whether it's related to high blood pressure, depression, diabetes care, but also understand at the individual level what care might be necessary as people move from one provider to a very separate provider elsewhere. There's a lot of waste that happens in healthcare and waste of dollars, as well as exposure to more procedures, because data is not shared. And when the data is not shared, tests get reproduced that may not need to be reproduced. So we are moving towards with very great detailed attention to privacy, but sharing data in a way that's meaningful so we can address the needs of the state. In addition, while we don't have it in our state yet, I think in the 2019 legislative session, New Mexico will be moving towards what's called an all-payers claims database, often abbreviated APCD, one of those acronyms. What that means is the claims data from all the different insurers in the state would feed into one data repository as well. And that would bring clarity to the dollars that are flowing through the system and where they're being spent and how they're being spent, and kind of shine the light on where things are not being allocated in a very smart manner for our state and our citizens. So those movements towards transparency of cost and transparency of what the community needs on a clinical basis, I think are going to be ultimately empowering for us as individuals and communities in terms of designing systems that we need. I'm very hopeful. Now, the ultimate outcome of that, and we're talking potentially years down the road, but kind of the holy grail that we go for is my health data sticks to me as an individual and not to the institutions that I have to move through and across that may not share that data. Exactly. And that enables me to be empowered to manage my own care with the providers.
Yeah, I'm glad that you're talking about the health information exchange and health information collaborative movement. I think it's so important. We have snowbirds that come down here. I think statistically, the average person sees something like 8, maybe 10 different providers in their lifetime, and that's really not a small number. Some folks see far more than that over their lifetime. Medical records get left at doctors' offices and aren't forwarded to the next place. And I think that as we move forward, health information systems are going to be extremely important. Especially, I just think of an example of somebody maybe from New Mexico. Maybe they've gone to Illinois to visit family or friends, and suddenly they're unconscious and nobody knows what medications they're on. They can't speak for themselves. Maybe they're incoherent or unable to communicate. By having information on that person, you could go into like you said, a very protected, private space where only healthcare professionals, licensed healthcare professionals, and other healthcare professionals are able to access the information. But by having that information, they can be as certain as possible to give you the treatment that you need in the time that you need it, and that it would avoid adverse effects to some protocol or regime you're already on. So I think the health information exchange is going to be key in reducing healthcare costs, and like you said, transparency. I love the idea of an all-payer claims database. When we budget for our household, we think about all of the costs. And I think healthcare has been one of those things where, sure, it costs money, but nobody's really taken a step back, or we've not collectively taken a step back to say, what can we proactively do to gather information to do it better? And so I think an all-payer claims database is really going to help us. So that's really good to hear.
Yeah, and it's got to be meaningful data. And unfortunately, a lot of the electronic health records that your doctors are having to enter information in, and what makes it hard for them to look up from their computer and actually see, hey, there's a patient here in the room, it's been historically driven by gathering data to submit for billing purposes, which is not as nearly as important as how gathering the data that's meaningful for managing your care. Yes, how we pay for it is critical. How dollars flow to reimburse that great care is critically important as well. But I think we've lost sight of what meaningful data is, and there tends to be overproduction, if you will, and distraction in how data gets entered into the system. So there's a lot of activity these days around data analysis, which is great, but it's really got to impact care, reducing cost, reducing the amount of hospitalizations, and let people get the care they need.
Well, I think that now that you mention it, one of our last guests, actually our first guest here for today's Healthy Community, we had the honor of having the president-elect of the American Medical Association, Dr. Barbara McEnany. And she was talking, she attended and was the keynote speaker at the annual healthcare provider dinner here in Southwest New Mexico about a month ago. And one of the things that she brought up that the American Medical Association is looking at when you talk about information that's collected just for the purposes of claims is introducing clinical codes that could be also applied to a person's record that recognize social determinants of health. Are they able to access health care? Do they have transportation? Are they able to adhere to their medication? Are there cultural or historic familial pressures and challenges that might be affecting their ability to receive and benefit from health care? But then she and I were discussing the importance of being able to reach out and invest in our communities and reduce risk, ultimately reducing the cost of health care through things like this program, through health literacy, through educating patients who ultimately with their healthcare team have to make the final decision on what their choices are and what they think is going to work best for them. So I think that that's all really, really good information, and I think that having usable data, you can collect all the data you want, but if you can't use it to make a difference, then it's kind of a waste of time.
Absolutely, and some of the great work that's being done around data and the analysis of that data is identifying risk, health risk that translates into financial risk as well, because every health event is also a financial event for folks too, but also at the community level, at the state level, at the national level. So we're getting better and better as we get more data pulled from a variety of sources to say, hey, I think we're headed for trouble with this community or with this individual. Let's intervene before it gets too costly. Rebekka, what's interesting is we spend somewhere, we've heard it said in a variety of different settings and numbers, but somewhere around 18 to 19% of our GDP in the nation on health care. And if we were any other industry, we'd be talking about growing that to 25% or 30%. Growth industry is great. But the reality is those dollars that are often spent on futile care late in life or are not really getting people back to a health state that they could have been in had we prevented these issues, those dollars could be spent on elementary education and other infrastructural opportunities if we can keep people healthy. So we're looking at how do we shrink that proportion of our spend on health care by reducing the need for health services by keeping people healthier. I like to say it's kind of a duh. Don't you want to do that? Well, absolutely. How you do it's really hard, but we really want to shrink the dollars going into health care by reducing the demand by keeping people healthy. And think that means being proactive,
yes,
engaged, and also understanding that we all have risk in our health and we all have end-of-life issues as well, and being empowered to manage those is really critical.
Yeah, and I think, when we talk about later in life, I think a majority of the healthcare dollars, or at least a significant percent, is spent on the last few years of a person's life. And I think that's where the advanced directives come in for patients, and we can talk about that sometime. When you talk about saving healthcare dollars to put to other things like early childhood education, I think about saving money on healthcare costs and creating kind of a synergistic energy that results in perhaps something wonderful, like taking some of the healthcare dollars and finding out we don't need to spend them on chronic care or emergency room visits that are unnecessary, and putting it towards hiking and biking paths, improved public transportation, which again ultimately leads to a better quality of life for the folks in the communities that they live in. So this is all really good information. Talk to me about some of the changes that are coming, or resistance to change. And we've only got about 2 or 3 minutes, so I'd like to get some final thoughts from you on maybe the way forward.
Well, and one of the unfortunate challenges with the current administration in Washington is, rather than pulling people together in a larger risk pool where that cost shifting is happening less, and we have mutual accountability for how dollars are spent, there seems to be a tendency back towards fragmenting populations and taking them out of risk pools and making some risk pools more costly and others less costly. And unfortunately, that leads to poor outcomes for communities and resources not getting to where they need to be. I'm concerned about those headwinds that we face. Yet we still work hard to go upstream in the care spectrum to keep people healthier, so that to mitigate against those effects. But that's something that's a challenge that we face. How the dollars flow through these different risk pools, as opposed to the dollars flowing into a larger, more coalesced risk pool.
Well, Dr. Epstein, I think that this has been a wonderful opportunity to speak to you. In fact, we're looking at putting together a health and wellness fair community forum here over the next several months, and inviting speakers to come down to public forums and speak to groups of residents of this community on how we can improve our health and find those better qualities of life. I want to thank you so much for joining us today, and you're welcome back anytime to come speak to our community, come visit on our show, and certainly we look to you for information as it develops, and as you feel you would like to share it with us, we'd be more than eager to hear from you.
Well, I appreciate the opportunity. I'd love to visit Southwest New Mexico. It's so beautiful there. Any time.
It is truly beautiful. Well, folks, we're going to wrap up our show today. You can visit our Facebook page at Today's Healthy Community in Silver City and offer questions. We will be able to answer those questions. And our show is produced by Justin Blanton. Thank you to our station manager, Kyle Johnson. Until next time, next Friday from 12 to 12:30, everybody enjoy your week in this beautiful weather and stay healthy.